Chairman, dignitaries, and my friends, good evening. As my previous two speakers were deliberating, with the available resources, what we have in our setting, we need to adapt ourselves to prevent complications. Some centers may not have the adequate resources for financial reasons due to restrictions, maybe due to some governmental delays. So this presentation is all about a complication which none of us want to occur during our surgeries, that is CSF fluid leakage. So it is not very pleasant when you see CSF leaking out through your surgical wound, especially after a very good spinal surgery. So the problem is that there are a lot of associated comorbidities which will automatically set in. So we all train our trainees to have a good technique in your hand, close the dura properly, more important, close the fascia properly so that there is no CSF leak. But there are some areas or avenues when we cannot achieve that, especially in MIS. So what we resort to is onlay material which will prevent CSF leak. But the problem with them is that they may not integrate with the other tissues as well. So there, when you re-explore such cases, you must have seen it is forming an independent layer over the dura, yes, but it never integrates with the host tissue very well. So it doesn't augment wound healing per se. It just prevents the CSF leak. So there are several agents available in the market in varying prices to help you, but this is something which the patient himself has or herself has. Why don't we use it? So this was a thought process. My previous speaker Shan was telling about getting collaborated with your friends in your hospital. So the friend here in your setting will be the transfusion medicine specialist in your blood center. So call him into the OR. They'll also be liking to come into the OR and see what's happening. They just deliver the corresponding blood group, the blood packets of the corresponding blood group, but this is the avenue when they also would like to come in. So this is autologous, it is readily available, cost effective because it is from the patient himself and there is no risk of immunogenicity or allergy. So the PRF matrix, as you see in the picture, it is a definite physical barrier. It is much better than the fat graft that we put because that can move off the fat graft, and in some patients the fat may not be readily available. So it contains entrapped platelets, so that will release the growth factor. So over weeks, it will help wound healing also. And of course, it contains leukocytes, so you are not that worried about infection. So of course, we go through the protocols, and during surgery, all that you want is 10 ml venous